and I think what I found out was, you know, you really need to find out for yourself and go check these places. If you Google or whatever, I have to use Bing for my searching and things, but if you go online and you put in all on four, you'll get a lot of companies. Well, now you will get a lot more. Maybe when I did, and that was on, I mean, my first, when I came in and did the bottoms, that was in July last year. But I would say it was at least a year or a year and a half, maybe a year and a half before that, that I went to a different dental people in Chicago. It was downtown Chicago, and just to explore about it, and I found out it was not, you know, it's not the cheapest thing in the world, but it's less than if you had an individual implant put on every one of your teeth, because they're putting 4 implants in, and then they have some titanium bar and mount your permanent teeth on that. And so the more I looked into it, the more I thought, well, maybe this is for me, you know. Otherwise I'm going to have, because I would have more problems. I would have to have 2, 3, 4 more implants. And then what about after that, you know? I mean, more. And it would just be thousands of dollars, and it would just be piecemeal. So I got to give my home dentist, you know, credit for encouraging me to explore it. And I did go to the oral surgeon that I went to, who was very good at did the 2 implants that I had. I did go to him and ask him about it. He said it has been discussed at conferences they have, and so he himself didn't do it, and I don't believe he's doing it now. I don't know if there's anyone in the South Bend, Mishawaka area. I couldn't find anyone a year and a half ago doing it here. So, but I will say I found Dr. Atcha's videos online. I think through YouTube or something like that, and he's being interviewed by someone for a health show, and he tells about it, and I think he tells his own mother has had this done by him. And my mother-in-law as well. Okay, so so obviously they believe in it, but at any rate, it just you know, I don't think I had anybody tell me it can't be done, and so matter of fact, even after I went last summer and got the lower teeth done, when I was having trouble with my upper teeth and whatever, I had made the decision to just get the lowers done and see how that works out. Maybe 3, 4, or 5 years when things really get bad on the top, go, you know, do them. In the meantime, though, I went back to see the oral surgeon here, and this and that. We talked, and he said, well, it seems like they're working out for you. He said, maybe you should consider doing the same thing on the top, you know. And, you know, he may be your competitor one of these years, you know, but I asked him, are you thinking of doing that? You know, he says, well, not at this point, no. His specialty is trauma, really. People who are in car accidents and stuff like that and have problems. And he's just an expert on that. That was the local guy here. But so I was happy to find there was someone in Indiana, although Dyer is not like just driving to, you know, to Plymouth, but it's not that much further. I mean, he says an hour. I think you'll find it's longer than that. But at any rate, when I go, I just take State Road 2, becomes 20, get on I-94, then I get on I-65 to drop down to Merrillville, get off on 30, and 30 over to Dyer. And I would say maybe an hour and 40 minutes or an hour 35 minutes, something like that. You can make the trip. And I have made the trip, and I did make the decision last winter to do the uppers as well. So I was about ready at that point to have the permanent put in on my lower teeth. You have to go with a temporary for 3, 4
Yeah, we'll
months.
get into all that
later.
in our presentation.
But I can tell you the temporary is really heavenly. I mean, that's what I have in my mouth right now. They look fabulous. I haven't looked this good for years and years. And, you know, and so I'm happy. You know, I think it's been a pretty good experience. Pain-wise, man, very, very little pain. You know, when I did my bottoms and my top ones, very, very little pain. I did have black and blue bruise marks and swelling, and you just plan on not seeing a lot of people for about a week or 8-9 days afterwards, and that'll go away. And, you know, because I think we just did the teeth a month and a half ago on the uppers, and you know, I'm back to normal, and I'm chewing things. I've never been a big steak eater. I like pastas and those things, so when they say for the first so many weeks that they want you to eat soft foods, that was no problem for me. And but even with what I have now, I have my temporary on both the top and the bottom, and we'll get permanence on both of them this fall. And I'm looking forward to that. But it's amazing. It's amazing how well I can chew with this. You know, just.
And these are just your temporaries, so it has helped you tremendously.
These are temporaries. They're made of an acrylic, I think it is. And later, when you get the permanent ones, that's when you get the titanium bar. So, I have to say I'm satisfied. It's you know, it's an investment, but you know, if you have a choice of various things in your life, you have to decide how important it is to have that. My older brother, he has upper and lower dentures, and when he found out how I'm doing, he says, "Man, I should have done that." Of course, he did it many years ago. He's got his dentures, so I don't know that it was around at that time.
Great. Well, thank you very much for sharing your experience. That way, everybody has a reality of